So in 2026, there are a number of different options available to treat an enlarged prostate. And in this video, we'll review the different options that are in front of you. So first of all, one of the most traditional options would be a TURP procedure. This is a transurethral resection of the prostate. Another option is a HoLEP procedure. This is a holmium laser enucleation of the prostate. Another option is Rezūm, which essentially is steam ablation of the prostate. Urolist is another option, which essentially is a stitch into your prostate. And then finally, one of the newest options is aquablation, which essentially is a water jet for your prostate. Now, what we often find is that a number of men that come to see me are absolutely bamboozled by the different options that are available for them. So in this video, we'll look at the different options that are available and what is best for you individually as a potential patient. So I'm Sotonye Tolofari. I'm a consultant urological surgeon based in Manchester. And as I've just described, a lot of men come to see me because they don't really know the best treatment option that's available for their enlarged prostate, because there are so many options that are out there currently. These men have often heard about lifestyle changes, about different tablets they can take, and all the different options surgically that are available to them. But they're often confused about the best way forward. Okay, so in this video, we're going to be focusing on one of the treatments that a lot of men come to see me about, which is Rezūm steam ablation of the prostate. So if you have an enlarged prostate, listen to this. When men come to see me and they are diagnosed with an enlarged prostate, the first place that we start is by looking at certain lifestyle aspects and medication. Lifestyle modifications might be things such as reducing alcohol, reducing caffeine, reducing carbonated or fizzy drinks, and reducing spicy foods. Moving on from that, we may try some medication, which we've spoken about in a previous video. And then finally, if none of that has worked, we then can consider surgery. For many men, they do find that tablets do help. There's two types of tablets that we use for men with an enlarged benign prostate. First of which is a tablet that helps relax around the prostate and improve the channel for you to flow and wee through. And the second of which is a medication that actually helps shrink the size of the prostate and therefore reduce the pressure on your water pipe or your urethra. Now, the issue with medication is that the medication actually helps manage your symptoms, but it doesn't actually remove any prostate tissue. Although it treats the symptoms, it does not remove the underlying cause. For some men, tablets work well for years. But for other men, the effect gradually wears off over months or years. Or in some men, the side effects might be too difficult to tolerate. Common side effects of some of the medications could include dizziness when you stand up, for example, loss of libido, difficulty with erections, or difficulty with your ejaculation. Now, Rezūm works differently because Rezūm is actually a surgical procedure. So the way that Rezūm works, where we inject steam into the different lobes of the prostate, over time, that steam actually destroys some of the prostate tissue, and the prostate slowly shrinks away and therefore opens up the channel for you to be able to wee again properly. So the key difference here is medication actually controls the symptoms but does not treat the underlying cause, whereas with Rezūm, we actually destroy some of that enlarged prostate tissue and therefore have treated the underlying cause to hopefully get you weeing again properly. So for men who have had problems with side effects from tablets, who don't want to be taking tablets for the rest of their life, or who have taken tablets that no longer work, Rezūm can be a logical next step. If tablets aren't fixing your prostate problems, listen to this. A Rezūm procedure and a TURP procedure, so a transurethral resection of the prostate, are often compared to one another. The reason being is they both aim to do the same thing. They both aim to improve flow in men who have got problems with an enlarged benign prostate. We know that the TURP procedure is highly effective at removing prostate tissue and therefore improving the channel for you to wee again. And it's one of the most traditional procedures that we do in urology. The problem is, it is associated with some side effects. It is quite an invasive procedure. After a TURP procedure, you may be in hospital for 1 or even 2 days. You may have a large catheter, which is a small plastic tube that goes up the water pipe into your bladder. That will be attached to bags of fluid that wash away any debris or blood from the inside of your bladder and prostate. You may find that after a TURP procedure, it takes you at least 4 or maybe even 6 weeks to fully recover from the surgery. There are risks with side effects with a TURP as well. With all surgery, there's a risk of bleeding. There's a risk of damage to some of the local structures or the nerves around your prostate, which may lead to problems with incontinence, problems with ejaculation, or even problems with your erections. Now, Rezūm is much less invasive. Now, all the most recent research suggests that the risk of problems to ejaculation, erections, incontinence is almost negligible with Rezūm, meaning it's become hugely popular, particularly within younger men. There's no cutting or actual removal of prostate tissue during the procedure itself. What we actually use with Rezūm is an injection of steam into the area, particularly within the lobes of the prostate, that slowly destroys those prostate cells over time, which opens the channel for you to wee again properly. This procedure can be done under either sedation or a local anaesthetic, which means you can avoid a general anaesthetic, and it can be done as a day case procedure, meaning you're in and out of hospital in the same day. Now, symptom improvement with Rezūm is often slower than with a TURP because we're not actually removing any tissue or prostate tissue. What we often find is that because we've injected steam, the prostate tissue will shrink away over many weeks and sometimes even many months for us to see the full effect of this particular procedure. However, many men might prefer this trade-off of slower symptom improvement with the preservation of your sexual side effects. So the choice isn't about which treatment is better, it's more about which treatment is most suited to you as a potential patient. Rezūm isn't always forever, and that's important to understand. So one of the most important questions that men ask is, how long will the Rezūm procedure last? And one thing to be clear on, Rezūm is certainly not a temporary fix like medication is. So when we look at the most recent research about Rezūm, we know that the retreatment rate, so this is the number of men that will go on to need further treatment, either further surgery or otherwise, at 5 years is about 14%. So that means that over 80% of men have not required any further treatment at 5 years. As Rezūm is a relatively new procedure, the data that we have lasts for about 7 to 8 years. So after that, we can't be entirely clear as to whether you may need further surgery, which might be a retreatment with Rezūm or surgery with another procedure. I think it's important to mention that the prostate can continue to grow over many years. So even though you've had a surgical treatment previously, it may be that the prostate continues to grow, and many years later, you may need more treatment, particularly if you're a younger man. Some men never may need retreatment, but others may need treatment further down the line. Now, this doesn't necessarily mean that the Rezūm treatment has failed. We know that BPH is a progressive disease, and in many men, over a decade later, even with a TURP procedure or otherwise, it may be you need retreatment. So the goal here is not to find a treatment that lasts forever, it's to find the right treatment for the right person at that right time. And for many men, having a Rezūm delays the need for more invasive surgery at a later stage. Rezūm recovery is not what most men expect. So recovery after an operation is a major factor in deciding which is the best treatment option for that particular person. As I've mentioned, Rezūm is not an instant fix. What we often find is, immediately after the procedure, where we've injected steam, the prostate can become inflamed, and that in itself can be quite uncomfortable. After the procedure, you'll have a catheter inside, so that's a small plastic tube that stays inside. That normally stays inside for anywhere between 3 and 7 days after the procedure. We usually bring you back to the hospital and then remove that catheter. When the catheter is removed, one thing I always remind my men is that the first few times you go for a wee, it's going to sting, it's going to burn. You may notice there's a bit of blood in the urine. You may even notice there's a bit of debris in the urine as you pass out slough from the prostate. These symptoms usually resolve quite quickly within the first few hours or days, but it's just important that you're aware of that before getting into the procedure. This phase is entirely expected and is temporary, of course. Improvement in your symptoms usually happens gradually over the course of the first few days to weeks, and then by about 3 months, we've usually seen the full effect of whether this Rezūm treatment has worked for you. The slower improvement is a trade-off, I suppose, with a less invasive procedure that's got a lower risk of side effects. I think it's really important that any man who's considering Rezūm really understands that timeline quite clearly. So whilst it might be slightly disappointing that there's no immediate relief, the long-term outcomes are still very good. Not all prostate treatments affect sexual function the same way. Sexual side effects are one of the biggest concerns in men that come to see me when they're deciding on prostate treatment. This is where Rezūm differs significantly from some of the other surgical counterparts. Rezūm is almost designed to preserve sexual function. So when we look at all the most recent research, for patients who have had a Rezūm procedure, the risk of problems with erections and problems with ejaculation is almost negligible compared to other surgical procedures. That being said, no treatment is risk-free. Some men might experience temporary alterations in their ejaculatory function in the very early stages after a Rezūm treatment, but that does usually self-resolve. For those men who place a high priority on preserving their sexual function, Rezūm is often the treatment of choice. However, your suitability all depends on your prostate size and anatomy. So routinely, if you've got an extremely large prostate, and by that, I mean a prostate that's over 100 grams, Rezūm is often not the best choice for you. So Rezūm isn't right for everyone. and this is why. So Rezūm is often marketed as simple and easy, which it is for the most part. But whilst it's minimally invasive, it's important that we're honest about the downsides. Rezūm does not work for everyone. So for example, if you've got a particularly enlarged prostate, we know that the research shows that you may be better suited with either a TURP operation or a HOLEP procedure, which is a holmium laser enucleation of the prostate. And by enlarged prostates, I mean prostates that are well over 100 grams in size. So we know if you've had urinary retention, Rezūm may not be that appropriate for you, as the research just doesn't exist in this area. Another issue with Rezūm is that the symptom relief is not immediate, and it may take weeks or even months for you to see the full effects of this procedure. There's a small group of men who may need to continue to have medication even after the procedure, which in some cases defeats the whole purpose of the surgery. There's a short inconvenience in having a catheter for a period or a week or so after the operation, which many men just really don't want to tolerate. Understanding all the different aspects here are absolutely essential in you making your decision-making about if Rezūm is the right treatment for you. So as I say to all my patients, the best outcomes for surgery, particularly for Rezūm, is when we treat the right patient for the right reasons at the right time. Lifestyle changes, medication, Rezūm, and a number of different aspects of urological surgery, really useful adjuncts in treating an enlarged prostate. The right choice depends on the patient, the prostate, the symptoms, and the individual wants and needs of that particular patient at that time. So what should you expect on the day of surgery when you are listed for a Rezūm procedure? So first of all, this can be done either as a general anaesthetic, which is where you're put to sleep for the operation should you wish. It can be done under sedation, where you're given some medication that helps relax you during the procedure itself, or it can be done as a local anaesthetic, where we give some local anaesthetic down the water pipe to help numb the area to allow us to do the procedure. You'll attend on the day, and it'll be done as a day case procedure. You'll meet myself as a surgeon and the anaesthetist who will look after you during the operation. You'll go in for the procedure. In the procedure itself, we will place a camera down the water pipe up towards the prostate. We'll be able to see where the prostate is, and we will inject steam to either side of the prostate. The injection of steam lasts for 9 seconds. We'll then place a catheter into the bladder afterwards. This essentially is a small plastic tube that goes up the water pipe into the bladder. Following on from this, you'll then be discharged back to the ward or the day case unit. You'll be seen by myself afterwards and also by the anaesthetist afterwards. Once you've fully recovered, after a couple of hours from the surgery, you'll be discharged home with the catheter. The catheter would usually be on what we call a flip flow valve. So a flip flow valve means that you don't have to have a bag of urine that you walk around with. It essentially is a small tap on the end of the catheter. So when you feel your bladder filling up, you can go to the toilet as normal, empty the tap, and then close the tap. This just means you don't have to have a bag that you carry around with you at all times. Usually 5 days later, we'll bring you back to the day case unit, remove the catheter, and at that point, you can go home provided you're able to wee okay. At this stage, it's important to remember that you will have some stinging and burning when you go for a wee. You may have some blood in your urine. You may find like you're going for a wee a bit more often than normal, but these symptoms will improve over the coming days and weeks. And up to 3 months is when we see the full effects of if the surgeries work for you. So if you'd like to book an appointment with me, please follow the link that's in the description below.